I scored 279 on my STEP exams. And from my experience, these are the most high-yield radiology images for the USMLE. By the end of the video, you will be pretty confident going through these X-rays, MRIs, and CT scans. Hello everyone, this is Karim from The Match Guy. Before we get started, make sure to grab our high-yield resources for Step 1, Step 2, and Step 3. They are packed with everything you need to know about the USMLE. I will leave the link in the description below or the card above. So we will start with the chest X-ray. And the first important chest X-ray we will start with is the normal one. Because if we understand the normal, it will be pretty easy for us to understand the abnormals. And we have two important terminology. The first terminology is that when something appears white, we call it radio-opaque. And we have two materials that are radio-opaque. Calcium, for example, bones or calcified arteries will be radio-opaque. Fluids, for example, the heart, but if there was also pleural effusion or lung edema, it will also appear radio-opaque. The second terminology is radiolucent, and we call it for things that appears black. Usually the air will appear black, and guess which organ has lots of air? You guessed it right, it would be the lung. The second important thing is heart diameter. It shouldn't exceed 1/2 of the full diameter of the chest. If it did, it can be cardiomegaly or cardiac effusion. The first pathological chest X-ray is pneumothorax. As you can see here on the left, this is a normal lung. Now on the right, the lung is collapsed like this, and there is lots of air outside of the lung. This air will appear hyperresonance in percussion, and it usually happens from rupture of apical bleb, especially in spontaneous pneumothorax. Now, would you observe do tube thoracostomy or needle decompression? It depends. If it's a spontaneous pneumothorax and the person is asymptomatic, observe. If there was respiratory distress, do tube thoracostomy. But if it's tension pneumothorax, hypotension, jugular venous distension, and tracheal deviation, then you would do needle decompression without even doing chest X-ray. The next pathology is diaphragmatic hernia. Take a look at this nasogastric tube. It's called nasogastric because it's supposed to go from the nose to the stomach. Now observe how the stomach and the tube went into the lung. It happens from weakness of the membrane of the diaphragm that separates the chest from the abdomen. This membrane is called the pleuroperitoneal membrane. And this is a surgical emergency, so you need to take the patient to the operating room after intubate him. The next radiology is acute respiratory distress syndrome. This is a normal chest X-ray, and this is the one with acute respiratory distress syndrome. Observe that the lung appears more radio-opaque or white, as we said. Now the reason this happened is that there is atelectasis because there is surfactant deficiency. So the whole lung is collapsed, so there is less air, which usually appears radiolucent, so most of the lung will be radio-opaque, and we call it ground glass opacity. Now it happens in preterm infants, and the way you prevent it is by giving dexamethasone to the mother, or if the baby is already born with it, you can give the baby surfactant and oxygen therapy. Now take care of long-term oxygen therapy because it can cause bronchopulmonary dysplasia and also retinopathy of prematurity. The next radiology is lobar pneumonia. Take a look at the right lower lobe of the lung. As you can see, it appears radio-opaque because it's consolidation, which is fluid, and we said earlier that fluid will appear radio-opaque. There is two important information to be aware of. The first information is that streptococcal pneumonia will be the most common cause of lobar pneumonia. The second information is that you will see increased breath sounds and tactile fremitus, which will differentiate it from other lung pathologies. The last radiology is Tetralogy of Fallot. Usually the right ventricle will enlarge like this, and it will cause this boat-shaped heart. It has 4 defects: VSD, overriding aorta, right ventricle outflow stenosis, and right ventricular hypertrophy, which caused this characteristic boat-shaped heart. Extremely high-yield information is the severity of pulmonary stenosis will be the main prognosis of Tetralogy of Fallot. The second question is how would you decrease cyanosis? So you make the person squat. When he squats, you compress the blood vessels of the leg, which will increase the systemic vascular resistance, which will usually cause increase in the pressure of the left ventricle, which will reverse the shunt and decrease cyanosis. If you like the way I explain things here, you can try me or any of our amazing tutors for a free 30-minute session. And if you like the style, then you can commit to one of the packages. I will leave the link in the description below or the card above. The next radiology is barium swallow in achalasia. Can you see this characteristic bird beak appearance? Now usually this happens because the lower esophageal sphincter will fail to relax, due to loss of the inhibitory myenteric plexus. Now you will see dysphagia to solids and liquids, which is contrary to esophageal cancer that happen in all the people and present with dysphagia to solid first, then liquid. The second barium swallow is Zenker's diverticulum. Now if you can see here, it's problems in the inferior cricopharyngeal muscle. The food will accumulate like this, and it will start to regurgitate. It will also accumulate and cause halitosis and aspiration into the lung. Now, it's a false diverticulum, meaning the mucosa and the submucosa are involved, but not the muscularis. Now let's start with abdominal X-ray, and the first one you will see is pneumoperitoneum. Usually it causes air under the diaphragm like this, and it happens when a stomach or any other abdominal organ perforate. When it does so, the air will leak out and it will go upward by gravity. Now, the most common cause of it is perforated peptic ulcer, and again, it will cause free air under the diaphragm. This is usually a buzzword for it. The second abdominal X-ray is a small bowel obstruction, and it will cause air fluid level. As you can see, this is the fluid because it's radio-opaque, and this is the air because it's radiolucent. The lobes will be distended, and it usually happens from adhesions after surgery. The last abdominal X-ray is sigmoid volvulus. It causes this characteristic coffee bean appearance on X-ray. It usually happens in elderly from constipation, for example, and the management is endoscopic detortion. If you ever feel overwhelmed going through all of this alone, we have made a 7-day USMLE crash course. It goes over everything high yield for step 1, step 2, step 3. They are 6 to 8 hours live sessions per day. I will be one of your tutors there, among other amazing tutors, and it's completely risk-free. If you attend the first session and you don't like it, you will get your money back, no questions asked. Now let's go into the brain. The first CT brain we have is subarachnoid hemorrhage. As you can see here, it looks like a spider hemorrhage because this is how the arachnoid looks. It will usually present with thunderclap headache or worst headache of my life. You will see xanthochromia in the cerebrospinal fluid, which is yellow fluid from the bloody or hemorrhage that happens, and you need to give nimodipine to prevent the reflex vasospasm that happens a few days afterwards. The second CT brain is subdural hematoma. As you can see, it's crescent in shape, and it usually happens in elderly as a gradual onset. The reason for this is that when you grow up, your brain is shrinkage, so it will pull up the bridging veins of it. And when it does this, it will cause shearing of the bridging veins and the hematoma to accumulate. Now this is different from epidural hematoma, which is lengthy in shape. It happens from injury in the middle meningeal artery acutely after a trauma. This will cause lucid interval, the person will be asymptomatic, then afterward, the person will have rapid deterioration. The last brain image is an MRI of glioblastoma multiforme. It causes characteristic butterfly lesions. And as you can see, it crosses the midline because it's a poor prognosis, so it invades tissue. Now it will cause pseudo-palisading necrosis, usually when the cells accumulate around the necrotic tissue and it's GFAP positive. Ultrasounds are usually low yield on the exam, but remember this characteristic snowstorm appearance on molar pregnancy. Molar pregnancy will cause very high HCG, which will cause severe pregnancy symptoms like hyperemesis gravidarum, cecal uterine cysts, and it also causes hyperthyroidism because HCG will mimic TSH, so it will activate the thyroid glands. Now you need to do suction and curettage and to follow HCG to 0 to monitor the progression of choriocarcinoma, which is usually a complication of molar pregnancy. The last radiology is hand X-ray of scaphoid fracture. It happens from fallen out stretched hand. It will cause tenderness on the anatomical snuff box, and it will cause a vascular necrosis of the proximal segment because blood will go retrograde like this. So if you fracture this part, you can injure the blood supply. That's it. I understand some of you may need more explanation of this topic or any other topic, and I would be happy to explain to you one-on-one through the match guide. You will literally talk to me for 30 minutes. And if you vibe with me, then you can commit to one of our packages. Click the link below or the card above. You will talk to the support team, then they will connect you with me or any of our amazing tutors. Comment below for any questions or reach out to us at info@thematchguide.com. If you like the video, we will appreciate if you put a thumb up and share it with your friend who is also preparing for the USMLE exam. Don't forget to grab our free high-yield resources I told you about earlier and to check out Dr. Asad video on how to prepare for step 1 and step 2 in 2025 that will appear on the screen right now. We wish you the best of luck for your exam.